Welcome. Today we have Dr. Kathrin Schilling, and she is currently working at Columbia University, and she's going to tell us about what she's doing right now.
Yeah, so I'm an assistant professor at Columbia University at the Department of Environmental Health Sciences, and also the director of Trace Metals Laboratory, where we do a lot of analysis of metals in biological samples, and that includes also measuring lead.
Can you just give us a little overview of what your research is concentrating on right now as far as lead in the cardiovascular system?
So what we are looking at, we try to understand lead levels in blood, but also using other ways to understand what is our exposure to lead, and not only to cardiovascular disease. Actually, we are all kind of other diseases where lead could affect our health, and even low dose of lead exposure can affect our health. The good news is the lead levels in the US went down, and many other countries went down, but still there are lead. We still measure lead in people's blood, means we are still exposed.
Yes. The CDC made a post just this August that estimates 500,000 children in the United States are diagnosed with lead poisoning every year, which is an astounding number. And then also speaking with UNICEF, we're talking about 800 million children worldwide that are poisoned with lead right now. So your work is critical, and there just isn't enough research on the effects of lead, and the public really isn't aware of how pernicious this disease actually is. So it would be illuminating for us to sort of hear about your research and what you're finding.
So what's very important for my research is understanding, like making it possible to identify and measure it. So we go and we say, okay, people are exposed to lead, but then it's like, how often do we get our blood tested for lead? So is there facilities to actually a laboratory in the clinic to measure that? So we build a capacity that we can measure the lead in children in the blood and understand, okay, what is their exposure and how can we lower the exposure and keep like assessing that over a longer period of time.
Are you looking at different tests and sort of how to make it affordable for different countries in order to test their children? Because it seems like it's very cost prohibitive for developing countries to invest in testing for lead.
It's true, and it's also not true. Measuring lead in blood is not that expensive. I think I would make an estimate, it's probably $25, but of course you have to put it in perspective. But measuring that has a huge impact for the children. If you detect it early, you can have an intervention. If you have an intervention, that will basically help neurodevelopment for the children. So a $25 test, or let it be $40 even. I don't think it's expensive.
Yeah, not when you compare to the cost of what lead poisoning does to a child. What else are you studying as far as the effects of lead on different systems at the moment?
We are measuring the exposure together with other metals, because that can give us also information, not only lead, but also the other metals together can interact. So what we know about lead is like when people are deficient with iron or deficient in calcium, then we know that the toxic effect of lead is enhanced.
I would love for you to talk more on that, because I don't think people understand the impact of food deserts and the inaccessibility to nutritious food, how that actually hampers the ability for a child to protect themselves from exposure to lead. Their own body can resist a little more. I'm not saying completely. It's not like if you take enough calcium, your child will never get lead poisoning. That's not what we're saying. However, good nutrition can actually help prevent as much absorption.
So lead is mainly stored in the bones, and our bones is mainly made out of calcium. So if you have like a good diet with a lot of calcium, that means like the lead cannot be stored in the bone, not as much, because you have more calcium, and there will be more calcium going to the bone and not all the lead. The same is true with iron. Lead is bound to the heme group in the blood, so it replaces basically the iron in the heme group. Our body has a preference for the actual element it needs. In this case, it would be iron. But if you're low in iron, then lead looks kind of similar it
Yeah.
will take the lead.
Yeah. And sometimes it's a chicken or an egg with kids where you don't know if the lead caused some anemia or if the anemia is allowing for a greater level of absorption of lead. By the time we tested, Cooper was anemic. Our pediatrician, of course, was like, well, he has lead poisoning and that can cause anemia. We will never know which chicken came first, But I do think it's really important when we're talking about nutrition that it is a disenfranchised and marginalized population that most of the time doesn't have access to nutritious food. So not only are they being exposed to lead because they're in, dilapidated housing or what have you, but that they also don't have the tools in their own body because they're not able to consume the foods that would help protect them from absorbing that lead.
The problematic part with lead is also it stays in our body for a long time, 10 to 30 years. Because it's in the bone, and our bone just replaces every 10 years. So that means every 10 years, basically, you can lower the levels. What's particularly important if you think of women, if you think of menopause, the storage of lead is going to be released into the blood and then it's redistributed. So if you think of that, the moment it might be still in the bone, it's kind of feels like it's locked. But then when your bone regrows and replaced, basically, then it's going to be released to the blood and then it goes to other parts of the body where it can have a negative impact. And then you think about a child where the bone grows is very quick and the bone is fairly quickly replaced. So when you have an early dose of, let's say, a few months old, and then a year or 2 years later, already the bones have been replaced. So then it's going to go into the blood, into the system again.
I also have been talking with various organizations. And one of the things that has been put forth that I think is a really interesting idea is to have voluntary testing in schools. So if there's a kid that seems to be regressing, that the school nurse can do the finger prick. And the finger prick, is, of course, isn't exact, as you know, but it might be a really good first tool for a kid in school.
I agree, that would be a good way to start. I think one big question everybody would ask is if they want to have, if you have high cholesterol level, said, okay, you get these cholesterol pills and then we lower it. That helps you. But for lead, it's like, okay, this is now your number. And then everybody might ask, okay, it's high. What can I do to lower it tomorrow? Yeah. And that's probably, maybe that is the challenging part.
It can be an extremely overwhelming and scary thing for parents. Learning that your child has it, like you feel like you're in the middle of a detective novel because you have no idea where the source is coming from most of the time. And you have to figure it out. And it might be, like you said, coming from multiple sources.
So the idea what we have is using a new tool, which is using lead isotopes, measuring the lead isotopic composition of the blood. How can we measure the sources in us? Like the sources around us in us. That's the idea with what I said, with using this new tool, using lead isotopes. An isotope is basically something as like, everything is lead, but then there's a little bit lighter lead and a little bit heavy. If you see it as people with backpacks. So one has a light backpack, one has a heavy with a lot of stuff in the backpack, and they're climbing a hill. And the person who climbs the hill with a heavy backpack is very slow. And the one with a light backpack is very fast. So that's like the isotopes with the light back is very fast in reacting. And the other one with a big backpack is a bit slow. So that's what happens in the environment. And then we see that at the end in our bodies. So if you think of gas and oil and these things, the combustion of that has a very particular isotopic signal. That paint has how it's made has a particular isotopic signal. Your spices, where they produce, they have a very specific of this one with the light backpack and with the heavy backpack in it. And then we can identify them by measuring in that and see, okay, there's a little bit more of that with the light backpack compared to the heavy one. So that looks more like to, let's say, paint, or looks like more like to, like mimics more like the spices. Then we can say, okay, that's the source, basically. It's like a finger. It's like a fingerprint, basically, you know. But
that's not really widely available to the public yet.
No, unfortunately.
No, but this is something that would be an incredible advancement, because if we were to be able to determine which isotope it is and perhaps where the lead is coming from, that detective series would then end with the first episode. You know what I mean? It would just like end, because we would be like, oh, well, this is it. So that is groundbreaking, incredible research with the isotopes, I have to say. It's very exciting. As somebody who had a lead-affected child, you know, who watched her kid go from speaking, pointing, waving, interacting to nothing within 1 month, you know, as his lead levels went up. To me, that's extremely exciting, because if we can figure out where these kids are getting sick faster, then we can prevent even more damage. If there was something you wanted people to know about lead or your research, what would you want them to know?
We should not forget that lead is there. That's the first thing I would say. In general. It's still one of the major toxic chemicals in our environment, which causes the most healthy life years. More than PFAS, more than PCBs, more than PHs. That's why we need to put more awareness and more research, and definitely more testing and more capacity building. And we are on the right way. I would not say we will ever get it to zero. It's nearly impossible, I would say, but as low as possible.
Dr. Schilling, I just wanted to say thank you so much for coming by and sharing all your knowledge and sharing what you're working on. I'm very hopeful after talking to you, because I'm like, wow, there's really brilliant people in the world that are figuring this rebus out. You know, you're figuring the code, you're figuring this out. As challenging as times are right now, meeting people like you and meeting the people who are dedicating every day of their life to making this world a better place for everyone is just really inspiring. And so thank you so much.
Oh, thank you for inviting me. It was great. Fascinating. Thank you so much.